As this is a course about learning about stress and anxiety and helping us to manage and potentially reduce that stress and anxiety, let's start by being clear by what we mean by stress and anxiety. So first of all, stress. Now, this is a definition from the National Health Service in the UK, and they say stress is the body's reaction, so it's a physical reaction to feeling threatened or under pressure. They go on to say when we're stressed, our body releases a hormone called adrenaline. That's one of a few chemicals that are released when the stress response triggers in our body. And then the problem is that too much stress can affect our mood, our body, and our relationships. So one of the things I want to emphasize in this course is that stress in itself is not bad. There is a type of stress called eustress, EUSTRESS, which is a positive stress. It can energize us, it can motivate us. And in fact, we'll learn more about how stress is linked to our breathing, and it's constantly being triggered, and perhaps you could consider in a positive way. So whenever we feel under pressure, we feel stressed, and if it's excessive, that's where the problem happens. And you can think of it as excessive as long-term, or in terms of acute for a kind of very high level of stress. And this can lead to what is sometimes called burnout, the sense of physical, mental, emotional exhaustion. Okay, so that's what stress is. It's a natural way that we react when we're under pressure. Now, what about anxiety? How is that the same? How is it different? Well, there's certainly a lot of overlaps here. The NHS, again, they say anxiety is a feeling of unease. So it's more of an emotional tone to it. And it's associated with worry or fear. So it tends to be thoughts about the future and concerns about how we may or may not be able to manage that. And it can range from mild to severe levels of anxiety. Just like any emotion, it can be quite light or it could be quite strong. Now, this is an important point. Everybody has feelings of anxiety, particularly at some point in our lives. Maybe think back to exams or interviews that you've had or have coming up. And these certain situations, they trigger the stress response, and together with that stress response, there's the feelings of anxiety that come up. So feeling anxious is perfectly normal, and you may know this. But some people's feelings of anxiety are more constant, and we may have this at some time in our lives where we start to feel it in a more general way, and it starts to affect our daily lives and the choices we make. We might start to avoid things that we may have enjoyed in the past because we don't want to have that feeling of anxiety and all the things that go with it. So certainly overlaps between stress and anxiety, and there's both a natural level or a normal level, and then when it becomes too excessive, when it impacts our everyday life, maybe we need to do something to help ourselves manage that. So I'm going to share some of the signs of stress. There's physical, there's mental and emotional, and then there's our behavior. Again, we know what stress is, we experience it in our lives, but let's look at some of the different possible symptoms, and they may be relevant for us. And you may spot some of these symptoms that I'll share. You think, oh, I never knew that that's something that can be caused by stress. So it could be a sign. This is quite important, because when you notice the signs of stress, you're able to notice when your stress levels may be getting a little bit too high. And then you'll be able to use the breathing exercises that we're going to be learning to help you manage that. So physically, it could be headaches and dizziness, muscle tension and pain, issues with digestion or stomach, sense of chest pain, feeling of a faster heartbeat. So there's some of the physical aspects. Mentally and emotionally, difficulty concentrating, struggling to make choices or decisions, quite a common one. Feeling overwhelmed, constantly worrying, so the thoughts keep going on and on. Fearful thoughts, and being forgetful as well. And finally, the behavioral changes. So you may notice yourself being a bit more irritable or snappy, maybe affecting your sleep. Interestingly, too much as well as too little could be a sign of stress. Same with eating as well. Sometimes too little, sometimes too much. It's different for different people. Avoiding certain places or people is avoidance behaviors, which can end up causing more stress in the future. And then perhaps linking to addiction as well, maybe drinking more or smoking more. So these are classified as some of the signs of stress. Now, there may be others there, and just because you have some of these doesn't mean that it's definitely stress that's causing it. It could be something else, some medical condition or some other reason, something that you've eaten. But these are the possible signs of stress. So, having thought more about stress and anxiety and noticed some of the signs of it, let's do a breathing exercise. And I'll explain it now, and you can do this at any point during the day. It's going to be a 5-minute exercise. I like to stick to 5 minutes in this course. You could use a timer if you like, or you could just maybe glance at a watch or a clock. All you need to do is begin by noticing how you feel. Do you feel pleasant or unpleasant or neutral? Do you feel very pleasant or slightly, very unpleasant or slightly? Just notice how you're feeling and associate it with these words. And then sit upright, comfortably upright, and simply be conscious of your breathing. Breathe with your nose and notice the sound that your breath makes. Is it loud or soft or not possible to hear? And then notice the air as it enters and leaves your nose. And as you continue to be conscious of your breathing, notice, is one nostril blocked? Are they both blocked and you're having to breathe with your mouth? If one nostril is closed, then which one? Just notice. Don't need to change too much. And in terms of the air, notice the speed of the air entering and leaving your nose as it enters your body. What's the temperature of it as it goes in and comes out? After you've done the 5-minute exercise, notice how you're feeling now. Is it more or less pleasant or neutral? So noticing the effect of that. You may have done a similar exercise before, but have a go at doing this today and jot it down in your journal as to how that experience was for you.